We have seen the muscles connecting scapula to axial skeleton. Now we will pass on to muscles that connect scapula to humerus. Some intermuscular spaces are formed between these muscles and their contents are clinically important. We will look into them also. So this is the posterior surface of the scapula. You can see the glenoid cavity articulating with the head of the humerus, and this is the greater tubercle. And this is the posterior surface of the shaft of the humerus, olecranon fossa, medial epicondyle and lateral epicondyle. The first muscle we are going to see is teres minor muscle. Teres means rounded, minor means small. So it is a small rounded muscle. It arises from upper two-thirds of the lateral border of the scapula and is inserted to the greater tubercle. Okay. The next muscle arises from the lower one-third of the lateral border of the scapula and it goes anteriorly to get inserted to the medial lip of intertubercular sulcus. That is the teres major muscle, because it is also a rounded muscle, but even though it arises from the lower one-third of the lateral border, it is a larger muscle. So it is called major muscle. Okay, both these muscles connect lateral border to the humerus, but the teres minor is supplied by axillary nerve and teres major is supplied by lower subscapular nerve. Now let us see the actions of these muscles. Since they connect scapula to humerus, they can bring the humerus towards the scapula, that is adduction, and since they are posteriorly placed, they can bring the humerus posteriorly. That movement is extension. Now we will see the rotation movement associated with teres minor and teres major. So if we take a cross section of humerus here, the teres minor muscle is going posterior to the humerus and is getting inserted to its lateral aspect, whereas teres major muscle goes towards the anterior surface and is inserted to the anterior surface. Okay, now what will happen if this muscle contracts? Let us see. When this muscle contracts, it will pull the greater tubercle posteriorly like this. So that is lateral rotation. Okay, so teres minor is a lateral rotator. Now what happens when teres major contracts? You can see it will pull the medial lip posteriorly like this. So what is the type of rotation? That is medial rotation. So teres major is medial rotator, whereas teres minor is a lateral rotator. Now we have seen these two muscles. Now the next muscle is the long head of triceps brachiae. Triceps means three-headed. Brachiae means arm. So triceps brachiae is a three-headed muscle of the arm. The first head we are going to see is the long head of triceps. It connects scapula to ulna, not to the humerus. The olecranon process of the ulna is lodged in the olecranon fossa of the humerus, and long head of triceps extends from the infraglenoid tubercle of the scapula to the olecranon process of the ulna. But its two heads, the other two heads will be originating from the humerus. So together this muscle can connect scapula to humerus. Okay. Now you can see as the triceps muscle crosses teres minor and teres major, some intermuscular spaces are formed. One of them is quadrangular and is called quadrangular space. The other two are triangular. This is the upper triangular space and this is the lower triangular space. Okay, now let us see the boundaries of these spaces. The quadrangular space is bounded superiorly by the teres minor muscle, the capsule of the shoulder joint, and also the subscapularis muscle, which will be seen in the ventral aspect of the scapula, which will go into the subscapular fossa to the lesser tubercle of humerus. We have seen its origin and insertion, actions, everything. So that will also form the upper boundary of quadrangular space. Now, the lower boundary is formed by the teres major muscle. the medial boundary by the long head of triceps and lateral boundary by the surgical neck of humerus. Okay, now the upper triangular space is bounded superiorly by the teres minor, inferiorly by the teres major, and laterally by the triceps. Lower triangular space is bounded medially by the long head of triceps, superiorly by the teres major muscle, and laterally by the shaft of humerus. Now let us see the contents. Through quadrangular space comes the axillary nerve and the posterior circumflex humeral vessels from axilla to the posterior compartment to the shoulder region. Then it winds round the surgical neck of humerus. Okay, you can draw the vein also. I have drawn only the artery. So axillary vein and posterior circumflex humeral. So axillary nerve also winds around the humerus. So the another name for axillary nerve is circumflex nerve. Okay, so this axillary nerve will supply the teres minor also. Okay. Now the next space is lower triangular space. Through it comes the radial nerve to the posterior compartment. From axilla, it comes to the posterior compartment accompanied by a vessel known as profunda brachiae vessels. There is profunda brachiae artery and vein. Profunda means deep. So, deep branch of brachial artery. That is the profunda brachial artery. Now, the upper triangular space has not much contents. We know the circumflex scapular vessels goes to the infraspinous fossa, piercing the teres minor muscle. It gives off another anastomotic branch which comes through the upper triangular space. So the content of upper triangular space is anastomotic branch of circumflex scapular artery. Okay, so these are the contents of these spaces, and let us see the clinical importance. So what will happen if the shoulder joint is dislocated? Humeral head will slip downwards. So it can injure the axillary nerve. What happens if these muscles are enlarged or hypertrophied? The space will reduce and compress the axillary nerve. Now what will happen if there is a fracture of surgical neck of humerus? It will also cause injury to axillary nerve. So these relations are very important in assessing the cause for axillary nerve injuries and the paralysis of deltoid muscle. Okay. Now, what happens if the the shaft of humerus is fractured? The radial nerve will be injured. So that is the clinical importance of lower triangular space. Now, there are some other muscles also which will connect the scapula to humerus. One from supraspinous fossa will be called supraspinatus muscle. From infraspinatus fossa, it is known as infraspinatus muscle. And these all will form a cuff around the shoulder joint, and that we will see in the next video. And also, we will see a course and branches of the axillary nerve in another video. Okay.